Hello everyone, my name is Dr. Lokesh Bhatia and welcome to this video on Lok Talks channel. If you are first time on this channel, I request you to do subscribe this channel, and in today's video I'll be talking to you about a test which most of the times we do order, and it is called checking your uric acid. So let's talk about what is uric acid and what are the problems because of it, why is it harmful for our body, and how can we deal with it. So these are the questions we are going to deal in this video. So what is uric acid? Uric acid is a waste product produced in the body when it breaks down into purines. Whatever we are consuming, there are certain substances which will break down into purines, and which are the natural substances found in many foods, including meat, seafood, and organic meats. Uric acid is excreted in the urine, but too much of uric acid can build up in the blood and can cause health problems. A high level of uric acid in the blood is called hyperuricemia. It can lead to gout when it deposits. The crystals get deposits in particular joint. It is called monoarticular arthritis, and the most common joint involved is the first tarso-metatarsophalangeal joint in the great toe. The inflammation there in the big toe is very common, and there is a commonest presentation of gout, right? So hyperuricemia can also increase the risk of kidney stones and other health problems. So these are very, very important things we need to understand. Next, let's try to understand why is uric acid harmful for our body. When uric acid levels in the blood get too high, it can lead to a condition called hyperuricemia, and the hyperuricemia can cause a number of health related issues, which includes gout, kidney stones, and heart diseases. So you can very well make out that how important is this to keep testing quite often. The primary concern is when uric acid levels become elevated, a condition known as hyperuricemia is being declared. I'll be talking to you further on the ways in which we can control the uric acid and the harmful effects of it in the body. So how to reduce those harmful effects? We'll talk about it, and what are the harmful effects? We'll discuss that. Number one is gout. One of the most well-known consequence of high uric acid is the deposition of the crystals in the joint, and it is called arthritis. It falls in the crystal deposition disorders. Alright, and these crystals accumulate in the joints, leading to the inflammation and acutely developed pain, swelling, and redness. The gout attacks can be sudden and severe, right? So third most next important point is kidney stones. Many people, when they get analyzed for what kind of stone problem they had, they find there was a uric acid stone. So elevated uric acid levels can contribute to the formation of kidney stones. Uric acid crystals can combine with calcium and other substances to create stones in the kidney, leading to pain and potential complications. How does the kidney stones present? Usually the pain in the loin to groin. The pain starts in the low back pain, and you feel that the pain is going forwards in the abdomen. So loin to groin pain is the commonest presentation for kidney stone. Next comes is kidney diseases. The chronic high levels of uric acid may contribute to the development of or the progression of pre-existing or existing kidney disease. So uric acid crystals can accumulate in the kidneys, potentially leading to the inflammation and can damage over a period of time. So to protect your kidney, keeping the high uric acid levels to control it within normal limits is very much needed. Next, the fourth important problem comes in the cardiovascular system. Some studies suggest a link between high uric acid levels and an increased risk of cardiovascular diseases. Right? So the mechanism behind this association is not very well understood so far. It's not fully understood at all. What is this association of cardiovascular disease with high uric acid levels? But yes, inflammation in the body is one of the factor which results in development of cardiovascular problems. Next important comes is insulin resistance. Elevated uric acid levels have been associated with insulin resistance, a condition in which the body cells do not respond effectively to insulin, leading to high blood sugar levels, and this sets in a vicious cycle. Okay, the high uric acid levels, insulin resistance leads to further high blood sugar levels leads to further inflammatory process in the body, and this is what leads to development of type 2 diabetes. So how to deal with high uric acid levels? Well, what the majority people recommend about, I'll be discussing that. I'm not talking about the individual variations. So there are a number of things you can do to deal with uric acid levels, to improve the levels. Eat a healthy diet. Avoid foods that are high in purines, such as meat, seafood, and some of the vegetables even. Alright. Instead, focus on eating fruits and whole grains. Right. Next important point is, as I said, to shift from non-vegetarian diet to vegetarian diet and more on the fresh green leafy vegetables and more of a purine-free diet. So next important is drink plenty of fluids. Staying hydrated, well hydrated, helps to flush uric acid from the body. Exercise, third important thing is exercise regularly. Exercises can help to lower the uric acid levels and improve overall health. Right? Maintain a healthy body weight. Okay, weight loss is very, very important. I have covered up in a few videos. You can check all those. I can share those links in the description box, and I can leave those links where you can connect to those videos. So to lower the uric acid levels and to reduce the high health problems. Next important is take medications. If you still have hyperuricemia, your doctor may prescribe you medications to lower the uric acid levels. Make yourself be aware about this fact that the common medication what we use are not the complications or not the side effect free medications. They have their own toxic effects. So don't keep taking in unprescribed manner. Use it for 1 month, 2 months time and then get it checked. Once it is normal, then you can stop it. If you are concerned about your uric acid levels, talk to your doctor. They can test your uric acid levels. Normally what my approach is, for males it should be less than 7, for females it should be less than 6.5, but my criteria is if it is more than 7, then I do repeat it in 2-3 weeks time by giving them dietary restrictions, and if it improves with that, that is what we wanted. No need to jump to start immediately unless there is one frank manifestation in terms of development of gouty arthritis. Last but not the least, avoid sugary drinks and processed foods. Limit your alcohol intake, get enough sleep, manage your stress very well. Right? Because if you are leading a very stressful life, your uric acid levels or the overall acidosis in the body will be of very high levels. So by following these steps, you can help to keep your uric acid levels in check and reduce your risk to development of health problems. Alright, thank you very much. Bye-bye. Thank you. Take care. See you in the next video. And do share it with your friends and family members. These are very, very common problems. Every day we keep encountering a lot of patients who are having hyperuricemia, high uric acid levels, which can increase a lot of workload on your kidneys. So it can result in, to summarize, it can have effect on the kidneys, it can result in cardiovascular effects, it can result in gouty arthritis. So these are very, very important things which you need to get it checked and keep your uric acid levels normal. By reducing body weight, yes, that is again another my experience. I had constant problem with my high uric acid levels. Once I've reduced my body weight, that is one biggest benefit what I have gained is reduced my uric acid levels to normal now, right? Otherwise, for almost 2 years time, I was facing frequently this issue that every time when 4 or 5 months time whenever I get my regular checkups done, the uric acid levels used to be coming on higher side of 7 to 7.5. So that is also has been reduced by reducing body weight. Though that is one of the biggest benefit, and as I said, there's the series which I am running on controlling body weight, the benefits of it, why we should focus on. This is also one of the videos to discuss that why one should reduce body weight and try to keep it in under control. Thank you very much. Bye. See you next time.